Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Toe injuries and disorders. Introduction. 14 of the 26 bones in your feet are in your toes. The toes help you move and keep your balance. There are many injuries and disorders that can affect your toes. There are many causes of toe injuries and disorders. Toe injuries and disorders can result in toe pain and other difficulties. Treatments for toe injuries and disorders vary. This program explains toe injuries and disorders. It covers symptoms of toe injuries and disorders, as well as treatment options. The foot and toes. The foot consists of many bones, joints, and soft flexible tissues. Joints act as hinges. They separate bones. Joints and muscles let the toes move and bend. Each joint is surrounded by ligaments that hold the bones together. Symptoms. Many toe injuries and disorders have similar symptoms. The main symptoms are pain and swelling in or around the toe joint. The pain may be dull or more severe. Other common symptoms of toe injuries and disorders are bruising, deformity or abnormal appearance of a toe, inability to move the toe or difficulty moving the joint. Some toe injuries and disorders may also cause a hard bump at the base of the big toe, changes in a toenail's shape, such as curled nails, pain, redness, or swelling around a toenail, thickened patches of skin on or around the toes. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Corns and bunions. Corns are thickened patches of skin. They are caused by pressure or friction on your skin. They happen where the bony parts of your feet rub against your shoes. Corns usually happen on the tops or sides of toes. Wearing shoes that fit better or using non-medicated pads may help. To reduce the size of a corn, gently rub them with a washcloth or pumice stone while bathing. Do not try to shave off the corn. This could lead to an infection. Shoe inserts may help. They can reduce friction and rubbing against your shoes. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. It can be painful. Smaller bunions can develop on the joints of your little toes. These are known as bunionettes. A bunion happens over time when weight is distributed poorly across the foot. This can make the joint at the base of the toe bigger. This usually happens because of tight-fitting or high-heeled shoes. It can also be caused by injuries to the foot, arthritis, and the foot's shape. A bunion may be treated by medicines to control pain, shoe inserts, taping and padding, wearing shoes that fit properly, surgery. Ingrown toenails. Ingrown nails happen when the nail sides or corners grow into the skin around the nail. This causes the skin to become red, swollen, and irritated. Ingrown nails are more common with toenails than with fingernails. In most cases, the big toe is affected. One cause of ingrown nails is trimming the nails improperly. When cutting your nails, always use a nail clipper. Cut straight across and never round the corners of your nails. Ingrown toenails may also be caused by heredity, repeated injury to the nails from everyday activities, wearing shoes that are too tight. Ingrown toenails can be painful and may also lead to infection. You can treat an ingrown nail by soaking it in a tub of warm, soapy water. Then, apply antibacterial ointment and a bandage. Contact your healthcare provider if you have a painful ingrown toenail or if you think it may have an infection. You should try not to remove the ingrown nail from the skin. Sprains and dislocations. A sprain is a stretched or torn ligament. Ligaments are tissues that connect bones at a joint. There are many ligaments in the toes that may be sprained. Toe sprains can happen if people jam their toe in the end of a shoe when stopping suddenly or landing after a jump, stub their toe on a hard surface or object. Treatment of sprains depends on the severity of the injury. It usually involves resting and icing the injured area, wearing a bandage or device to compress the area, using medicines to reduce pain and swelling. Dislocations are joint injuries that force the ends of your bones out of position. A toe dislocation happens when any of the joints slip out of their proper placement. Toe dislocations often happen if a toe is jammed or forcefully twisted or bent. They can also happen if the toe is bent backwards. Dislocated joints often are swollen, painful, and visibly out of place. You may not be able to move them. A dislocated joint is an emergency. If you think you may have one, seek medical care right away. Treatment for a toe dislocation might include a splint, bone repositioning, medicine, rehabilitation. When properly repositioned, the toe joint will be able to function and move normally again. Fractures. A fracture happens when any one of the bones in the body breaks. Fractures may affect the bones that form the toe. A fractured toe usually happens as the result of an injury to your foot. For example, a fracture can happen if you drop a heavy object on your toe, stub your toe. Stress fractures are tiny breaks in a bone, often caused by repetitive stress. Usually, stress fractures happen to athletes. They can also be a result of abnormal foot structure, deformities, weak bones. Treatment depends on how severe the injury is. If the bones are still in place and likely to stay that way, the toe may be placed in a splint. Surgery may be needed to treat more severe fractures. This may be when the joint is not stable or if a bone has broken through the skin. Pins may be used to hold your fractured bones together. Gout. Arthritis is an inflammation of the joints. It can cause intense pain and swelling in the joints. Gout is a type of arthritis. It results from crystals of a substance called uric acid that deposit in the joints. Normally, uric acid is excreted out of the body in urine. At times, there may be abnormally high levels of uric acid in the blood. This condition is called hyperuricemia. In some people, uric acid crystals deposit in the joints, especially the big toe. The immune system, the body's defense against sickness, realizes that the crystals should not be there and starts attacking them. This is what causes joint pain, swelling, and tenderness when a person has gout. If not treated, gout attacks can become increasingly frequent and painful. With proper treatment, gout can be stopped from getting worse and the pain can be managed. Gout is treated with medications. You may also be able to prevent gout attacks by avoiding certain foods, such as shellfish and organ meats like liver, brain, and kidney, drinking a lot of water and fluids, drinking alcohol only in moderation, losing weight.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. There are many injuries and disorders that can affect your toes, including corns and bunions, ingrown toenails, sprains and dislocations, fractures, gout. Many toe injuries and disorders have similar symptoms. The main symptoms are pain and swelling in or around the toe joint. Other common symptoms are bruising, deformity or abnormal appearance of a toe, not being able to move a toe. There are many causes of toe injuries and disorders. In some cases, toe injuries and disorders can result in toe pain and other difficulties. Treatments for toe injuries and disorders vary. They might include shoe inserts or special shoes, padding, taping, medicines, rest, and, in severe cases, surgery. Talk with your healthcare provider about which treatment options are best for you. Thank you for using Explain.